You know, when most people hear the words universal health care, they think, wow, that sounds expensive. But the United States already spends more on health care than countries that guarantee coverage for everyone. And according to supporters of the National Health Care Plan, the problem may not be that America spends too little. The problem may be where the money is going. Hi, and welcome to my channel, Not in Kansas Anymore. Thank you for tuning in, and I hope you enjoy this conversation. In the last two videos, we talked about the current healthcare system in the United States and a proposal called the National Healthcare Plan. But now we get to the question that usually dominates the healthcare debate: the cost. Could universal healthcare system actually work financially? Or is the current system already costing Americans more than it should? One of the central arguments behind the National Healthcare Plan is that Americans already spend enormous amounts of money on healthcare. We just don't always think about it that way because the costs are spread across so many different places. Most Americans already pay for healthcare through monthly insurance premiums, employer payroll deductions, deductibles, copay, prescription drug costs, and out-of-pocket medical bills. Employers are also spending massive amounts of money providing private insurance coverage to their workers. And, and federal and state governments are spending trillions through programs like Medicare and Medicaid, the VA system, and the ACA subsidies. So supporters of the universal health care agree that the United States is not lacking health care money. Instead, they argue the money is flowing through an extremely expensive and inefficient system. According to the National Health Care Plan proposal, the estimated annual cost of the program would be about $4.4 trillion per year. Now, obviously, that number sounds massive, but supporters of the plan argue something that's really important. The United States is already spending close to that amount right now. And according to the 2023 figures, the United States actually spent $4.9 trillion on health care. The proposal combines existing government health care spending, payroll contributions, and projected administrative savings. And according to the policy, total available funds could reach approximately $5 trillion annually. In other words, supporters argue America needs to be spending enough money to provide universal health care coverage. And if the numbers in the proposal are even partially accurate, the issue may not be whether the country can afford universal health care. The issue may be why Americans are already paying so much while still not guaranteed health care to everyone. Now, one of the biggest criticisms of the proposal involves taxes. The National Health Care Plan proposes a 12% employee payroll contribution and a 6% employer contribution, well below what it costs the average employee or employer right now. And for many people, hearing the word tax immediately raises concerns. But supporters of the proposal argue that Comparisons can sometimes ignore the costs people are already paying. Right now, millions of Americans spend large amounts of their income on health care. So the argument behind the proposal is not necessarily that Americans would suddenly start paying for health care, because Americans already are paying for their health care. The argument is that many existing health care expenses could be replaced by one more predictable funding. Supporters believe that for many middle and working class families, total health care spending could actually decrease under a simplified universal system. Critics disagree. They argue that taxes could grow over time, government projections could be inaccurate, and long-term costs may become difficult to control. And honestly, that's one of the most important parts of this debate. Not whether healthcare costs money, because obviously it does, but whether the current system is delivering enough value for the amount Americans are already paying. One of the most interesting parts of the proposal has less to do with healthcare itself and more with bureaucracy. Right now, hospitals and clinics across the United States spend enormous amounts of money dealing with administrative insurance costs, different claim systems, different provider networks, different billing rules, different approval requirements. There are actually entire departments that exist just to process insurance paperwork, negotiate claims, and challenge denials. The National Health Care Plan argues that simplifying this system could save hundreds of billions of dollars every year. The proposal includes a centralized billing structure called the National Provider Billing Portal. One system for billing, one system for approval, one standardized process. Supporters argue this could reduce overhead costs, reduce administrative waste, and make healthcare spending more transparent. The proposal also claims additional savings through negotiated prescription drug pricing, preventative care, and fraud reduction. And according to supporters of the policy, those combined savings could potentially create a surplus of revenue beyond the estimated costs of the program. And if those projections are even partially accurate, it would completely change the healthcare conversation in the United States. Because the debate would no longer simply be, can America afford universal health care? The debate would become, why are Americans already spending more than countries on health care that guarantee care to every citizen, but are not guaranteed the care themselves? The proposal also argues that long-term savings and surplus revenue could help stabilize other parts of the federal budget. Supporters believe reducing healthcare inefficiency could free up funding for rural hospitals, veterans health care, emergency preparedness, and potentially border deficit reduction. In other words, supporters believe healthcare reform is not just about healthcare. They believe it could reshape how the country spends money overall. And before we wrap up, if you've been enjoying this healthcare series, make sure to like the video, subscribe to the channel, leave your thoughts in the comments below. Do you think the United States is already spending enough money to guarantee healthcare coverage? Or would a system like this become too expensive over time? And if you want to read the full national health care plan yourself, as always, I will put a link to a PDF in the description below. Final thoughts. At the end of the day, every healthcare system involves trade-offs. But one thing is becoming increasingly difficult to ignore. The United States is already spending an enormous amount of money on healthcare, about 17% of our GDP. And despite that spending, millions of Americans still struggle to afford care. So maybe the real question isn't, can we afford to change the system? Maybe the real question is, can we afford to keep spending this much without guaranteeing health care in return? And in the next video, we're going to look at another major part of the healthcare debate: private insurance, personal choice, and what role the government should actually play in healthcare. Now, I may not have answered all your questions, and as always, I don't know that this is the right policy for this particular issue. I think it's worth a look. I think it should be talked about, because if we're already spending enough money to provide universal health care and it would lower the costs for everyone, why are we not doing it? Why has neither Republicans or Democrats put this policy on the floor and proposed making it a bill? But those are questions for another time. If you've made it this far, thank you. And I hope to see you in a week.